Zoom in public sessions, that agreed?
Agreed.
And can I remind people regarding mobile phones that they would be switched off or in the aeroplane mode. And I want to welcome all of our members and witnesses to the committee meeting this afternoon. I want to welcome from the Neurological Alliance of Ireland, Magdalene Rogers, who's the Development Manager, Professor Orla Hardiman, who's Professor of Neurology and Head of the Academic Unit of Neurology at Trinity College, and is also Consultant Neurologist at Beaumont Hospital, and Dr. Colin Doherty, who's the Consultant Neurologist at St James's, and also Mr. Jim Lawless as well, who's here as an advocate as well. And I want to welcome you all and thank you for being here. In the context of our discussion today, we're here this evening to discuss neurological health policy, and I would remind members and witnesses not to stray from the subject matter. It's neurological health policy. And before we commence, I want to remind witnesses regarding privilege, and indeed in terms of witnesses are protected by absolute privilege in respect of the evidence you are to give to the committee. However, if you're directed by the committee to cease giving evidence in relation to a particular matter, you continue to do so. You're entitled thereafter only to a qualified privilege in respect of your evidence, and you're directed that only evidence connected with the subject matter is to be given, and you're asked to respect the parliamentary practice to the effect that where possible you should not comment, nor criticise, nor make charges against any person or persons or entity by name in such a way as to make him or her identifiable. And members are reminded of the long-standing parliamentary practice or ruling of the chair to the effect that members should not comment on or criticise or make charges against either a person outside the House or an official, either by name, in such a way as to make her identifiable. Is Mr. Jim Lawless, who is a patient advocate, and I had the pleasure of meeting him, and Senator Crown, I know, has asked to be here. So, Mr. Lawless, thank you for being here, and the floor is yours.
Chairman, I would like to thank you and your staff for inviting me to give this presentation, and I also want to thank the other members of this joint committee. The Neurosurgical Centre Beaumont Hospital is not safe because...
Sorry, I don't want to be unfair, but the remarks you're passing, the hospital is not here. We have no function regarding the hospital, and our remit is the national health policy, and that's the framework of which we're discussing. And you know, even though they are your personal remarks, you may be making defamatory statements, and I have to put you on record that privilege doesn't allow you to do that. And I would ask you to be cautious in what you're doing, because it is about identifying people who are not here to defend themselves as well.
I take your comments on board, Chairman, but the point is I did give my presentation, the script, to your staff, and they approved it.
No, they didn't. No, they didn't approve it. No.
They didn't say there was a problem with the...
This committee meeting is a meeting of the House of Oireachtas. I'd like to hear your presentation, but I have to advise you, for your own sake and for the sake of the members, regarding the issue of privilege, that you shouldn't criticise nor make charges against any person or entity by name in such a way as to make them or him or her identifiable. And secondly, the entity you just named are not here to defend themselves, and you're making a charge against them, and they can't defend themselves, and I want to just advise you of that.
Chairman, patients who have suffered a brain hemorrhage are denied access to emergency neurosurgical treatment. Subarachnoid hemorrhage, SAH, is an immediate and life-threatening emergency. An estimated 460 to 1,290 patients suffer a brain hemorrhage each year. 10 to 15% of casualties die before they reach hospital, and about half of all patients die within 6 months. Guidelines for the management of SAH patients were introduced by HIQA in 2010. They were introduced to clarify the criteria for admitting patients for emergency neurosurgical or endovascular treatment. But these guidelines have not, nor could they, improve access to treatment. The reality is that the Neurosurgical Centre is grossly under-resourced. There are just 10 neurosurgical intensive care beds. The report towards excellence in critical care, the review by an expert group on critical care services in the Republic, was presented to the HSE in 2009. The report assessed the need for 52 intensive care unit beds and also 8 high dependency neurosurgical beds. I advised HIQA in 2008 that standards and measures of performance were required to address the inconsistency of decisions made in the Neurosurgical Centre to admit SAH patients for treatment. No action was taken until after the authority had been challenged in the Irish Times on the 29th of September 2009. The measures of performance which HIQA introduced were customised to satisfy the constraints of inadequate resources. Consequently, they restrict access to treatment and are unsafe. HIQA has also failed, despite several requests, to put in place a standard to measure the outcome for SAH patients admitted to an acute hospital but denied treatment in Beaumont Hospital. HIQA is not an independent authority.
Sorry, could I ask you just to withdraw that? Because
I withdraw that.
They actually are an independent authority, to be fair now. And I think that...
I'll withdraw it this time, Chairman.
Okay, okay, thank you. Okay, thank you. Under statute, under law, they're an independent authority, and we're not going to have a... I'll come back to that at the end of the presentation. Thank you, Mr. Lawless.
Chairman, corporate and clinical governance is poor. There is no clear separation of roles and responsibilities in relation to patient safety between HIQA, the investigating authority, and the HSE, which provides the funds for the health service. In 2012, 238 SAH patients were diagnosed, 138 were treated, but 100 were denied treatment. Now, Chairman, there is no information on the outcome for those patients who are not treated, despite several requests. The other point is that if those same patients, if those poor grade patients were to be admitted to the National Neurology and Neurosurgery Hospital in London, 53% of those patients would have made a very good recovery. We need to know, Chairman, what the outcome has been for the SAH patients who were denied neurosurgical treatment in 2011, 2012 and 2013. This information is available despite what all say. It is available because Beaumont Hospital is required to provide a patient management plan for each SAH patient who is referred for treatment, and that is where the information is contained. Letters are sent out from the Neurosurgical Centre to each referring hospital, so the records are in the hospital. There is a culture of secrecy and denial. The statement by Beaumont Hospital to the Irish Times that appropriate protocols were in place to ensure that SAH patients receive neurosurgical treatment were misleading. HIQA claims that the HSE is responsible for the safety of patients who require treatment. However, the HSE relies on assurances from Beaumont Hospital that the Neurosurgical Centre can provide access to treatment. But, Chairman, those assurances are not reliable. My written submission makes 13 recommendations on pages 33 and 34, and I urge this joint committee to carefully consider, approve and recommend for action to the Minister for Health. I just want to mention also, Chairman, that I would in particular recommend recommendation number 14.4 to increase the number of neurosurgical intensive care beds in line with the Towards Excellence in Critical Care Report, page 128, and also to review the standards of corporate and clinical governance at HIQA and the HSE, and finally, urgently review the outcome for mortality and morbidity for SAH patients denied treatment in 2011 to 2013. And there is one small change, Chairman, which is not a costly change, but the inter-hospital transfer of critically ill patients should have the same urgency as the emergency call to the 999 emergency call. That's not the situation at the moment, and I just want to mention a case where it took 3.5 hours to have a patient transferred from one hospital to the other because the hospital could not use the service of a 999 call to have that patient transferred. Thank you very much.
Thank you. And could I just make the point that thank you for being here, and I admire your passion, but just that the views you expressed are your own opinions. And as I said at the beginning, we don't have any remit to discuss the centre of Beaumont. Our remit is the national health policy, and also just fairness and balance. Neither HIQA, the HSC or the hospitals mentioned are here to offer a counter viewpoint. And in the interest of balance, we will have to maybe offer an invitation to them to come back to us. But I think, to be fair, you are entitled to make your views, but they're not here to defend themselves in the situation that are here. Okay, thank you. I want to now call on Deputy...
Brief word in relation to Mr. Lawless. I would like to thank him sincerely for his presentation, and it's just my first opportunity. I just want to convey, I know it's some years, but I wish to also offer you my sincere sympathy on the loss of your dear wife back in 2005, as you've indicated in your presentation. Now, can I just say, in relation to the points the Chair has made with you, Mr. Lawless, I very much welcome what you have presented to us. It's a significant piece of work in itself. And I noted that the Chair said to you that, the various entities, be it Beaumont, the HSE, HIQA, whatever is the case, I believe that we should send Mr. Lawless's submission to each of those. They should be put across it. And he has made several recommendations. Some are simple, some are more complex. But we should ask them to respond. And I would hope that that would be in some way a useful employment of the work and effort that you have put into preparing your submission before us here today. And I want to say it's deeply appreciated. Thank you.
Thank you, Deputy. And just on that point, I think it is important that we do offer the right of reply to emanating from our discussion today, because we are only hearing one set of presentations, and to be fair, I think arising from this, and I was going to make it at the end of the point at the end of our meeting.
I propose, and it's not only in relation to just for balance.
No.
I think.
Well, I was going to make
I'm putting it that I would like to hear what they'll have to say to what Mr. Lawless has said, and very much to hear their views in relation to recommendations that he makes.
I would remind Deputy O'Kieran that we don't have an investigative role as a committee. Our remit is not by that. But I think what is important is that we take from the meeting today and we present it to both the HSC and HIQA to come back to us and to meet with us on it, maybe perhaps. But I want to wait till after we discuss other people before we come back to that.
Chairman, and I'd like to welcome my professional colleagues and other representatives and Mr. Lawless for coming here today. I have a number of very focused questions I want to ask, but I want to just preface them by stating that in common with most parts of the health service, the neurological, neurosurgical, neurorehab, neuropathology, you name it, in Ireland, in terms of person power, is grotesquely underpersoned by any international comparison. And I'm going to ask some specific questions on this in a moment. So I don't want anybody to think that there's any part of me criticising either my professional colleagues or colleagues from other professions, because I think they do extraordinary and heroic jobs under very difficult circumstances. They've been placed in historically by successive governments and by the permanent government, who I believe have historically had a very unrealistic view of the way a health service should work, coloured virtually entirely as it is through the prism of Her Majesty's National Health Service, which I think for all its glories is by modern Western standards not the standard we should emulate. From the perspective of my day job, I have always been troubled by the adequacy of neurosurgical services in Ireland, not because I have any problem with the quality, the competence, the dedication, the diligence of the people who work on the front line in Beaumont and Cork and in other units, but because I just think they're grotesquely underprovided, and as a resource, it has always been my impression, and correct me if I'm wrong, that as a result of this, a series of band-aids are put in place over what is an inadequate service. In the first instance, it must be asked, is it appropriate that the ambulances in Dublin can take somebody with trauma, potentially with head trauma, to a hospital where neurosurgery may not be available? And let's face it, in Dublin there is one hospital where neurosurgery is available, and most of the acute hospitals which are on call both for neurosurgical trauma and for sudden catastrophic neurosurgical events such as brain hemorrhages will not have that expertise on campus, which means, by definition, that in 5 out of 6 hospitals to which they will be brought, if they have such a problem which requires that backup, there is the built-in delay and triage of having people at a remote site trying to deal with the problem telemetrically by looking at scans being forwarded over. I just know how if somebody close to me, if one of my precious family members had a neurosurgical catastrophe, the kind of service I'd like them to have, and because of the context I have, I know the kind of service they would have. And I don't believe this is the service that is routinely available to people that dial 999 and get brought in with an ambulance. And I think we need to have a real serious look at that. Secondly, and I must say, I met Mr. Lawless, and Mr. Lawless, I have to just say that you are obviously somebody about whom it will be accused that you are bearing a personal grudge or acting as a crank or something like that. And so the reality is, I found, I will not speak to the specifics of what happened in Beaumont, but I found the more general perception that somebody could look at how somebody with a neurosurgical potential catastrophe in Ireland is dealt with and find the situation to be wholly inadequate is just very plausible. Well, I'm sorry about that. And again, I'm not pointing fingers at any individual people or individual units, but I just don't think we do this very well. And I think we have to, and in truth, one of the reasons this meeting is happening today is because I suggested, and one of the reasons why I suggested is because I met Mr. Lawless. And Mr. Lawless was to an extent singing off a hymn sheet that I have had been warbling a few bars to myself over the years. I have to also just say that in terms of the whole question of, I'm a little troubled by this. I believe that individuals and identifiable individuals have an absolute reputational right. Absolutely. I don't believe that publicly funded bodies do, be it St. Vincent's Hospital or the Board of St. Vincent's Hospital or Beaumont Hospital or HIQA or the HSE or the Department of Health or any other entity. And we had the absurd situation recently where a respected medical journalist, Dr. Rory Hanley, wrote a piece about the problems with medical cards and got a threatening letter sent by a PR spokesman for the HSE. Now, I believe, for a start, the HSE should have no PR spokesman. I don't spokespeople. I believe that public servants should speak for themselves on their own track record. They should not be providing, they should not be spending taxpayer money to hire people whose primary purpose is not to foster communications, but to defend their reputation. And it has a chilling effect.
Sorry. To be fair, the personnel you're dealing with, or speaking about rather, are not here to defend themselves. And actually, you know, I mean, we must have balance. I mean,
invite him in. I will gladly hold the door open for him. I have no problem. I'll buy him a cup of coffee and I'd say it to his face.
Okay.
Okay. This is, and I haven't mentioned it, but it's wrong. We should not have a situation where journalists in a democracy, the backbone of a democracy is a critical press. That we can't actually criticise public bodies because the public body has some newly defined vague reputational right. I mean, could you imagine if somebody was prevented from criticising the FDA in Washington, or the National Institutes of Health in Washington, or the Pentagon in Washington, because somebody there said, we will threaten to sue you if you question the reputation of our organisation. We'd have no investigative journalism whatsoever if that happened. And for those reasons, I must say, I find myself very much in sympathy with the tenor of Mr. I have not read this submission in detail. But I would say that Mr. Lawless, I believe, has an absolute right to criticise any organisation he wishes without fear of legal retribution. If it's a public organisation, he should not.
Well, I mean, we're neither of us are neurosurgeons. I mean, I would say a general point about, you know, I suppose one of the things that's happened to me is I'm speaking, you know, with this kind of management hat of the HSE, and to my right and left are people speaking with very personal capacity, and I think their points are well made. You know, I got involved in this because I think the most complex thing we do is deliver healthcare, and it has to be delivered, and what people are crying out for is process. They're crying out for data, they're crying out for process. And when I go into when I started this program, we were, you know, we were a group of experts who were all providing, if you had epilepsy in Galway, your chance of getting the same sort of care as you were in Dublin was minimal. It was all very, very different. Now we're starting to standardise everything we do. And I think what Mr. Lawless, if I could, you know, say, acknowledging the hurt and the points he's making, he's crying out for a process to be put around what happens to people. And that's, you know, maybe what HIQA meant to happen in 2010. And I think it's a question of whether we as a profession of consultants have delivered on that process. And I think that's where the concern lies. If I talk about what I'm delivering on a daily basis here, the people I work with are crying out for process. And unless we put a process around it, it's not going to get fixed. So neurosurgery, yes, there are numbers, there are resourcing issues, there are bed issues, but unless you actually put a process around this complex delivery of care. I mean, I, for instance, don't believe that you can't safely manage a patient who has some neurosurgical issues in a distant centre. But unless you get the governance right, unless somebody takes responsibility at the neurosurgical centre for managing a patient who's in a distant centre, then they're never going to be looked after properly. There needs to be a set of trigger points for the movement of the patient. The patient has to be moved according to a set of protocols. If the patient runs into trouble A, B or C, and you're right, the ambulance service needs to deal with that as an emergency, like a 9-9. So they are all process issues. They're not resourcing issues.
I think I would echo what Colin is saying, and it does go back to the theme that we all have today, which is, I mean, it's very easy to say that our health service is it's inadequate, and obviously there are many problems in the way our service is delivered for our patients, and they're not all resource issues. And we are conscious that we're in the middle of the worst recession ever, and we're conscious that extra resourcing for the service that we're trying to deliver is it's something in the longer term that clearly we would like in whatever iteration we have, and to have the system fair and delivered appropriately. But in the meantime, I think that four of us who are presented here today would agree that there are many things that we can do differently with the same resources and more effectively. And I think that's the policy. There's a deficit between the policy and the process.
But on that point, and I appreciate where you're coming from, but surely the person who drives the train is talking to the conductor and talking to the mechanic in order to ensure we get the result at the end, which is what you're trying to achieve. So is there any integration between the HSE, the hospital management, and you, the professional, delivering on the ground? And if there is, then why are we talking about, given part of the resource issue for 1 second, because as you said, we're in a recession and we have cut back budgets. But if it's not about resources, then why isn't that happening?
Because I'll give you my personal view, and my colleagues here may want to develop it. I mean, the issue is accountability. It's what Colin said. Colin's responsible, but the point, the transcript that I gave you, who's accountable for that? There's no. The issue is around responsibility taking and accountability. The person who's responsible should be accountable, and the person who's accountable should be held accountable, and that's not happening anywhere within the system. And I think that's what Mr. Lawless was driving at, that's what Colin's driving at, that's what in each of us in the presentations that we've done, the common theme that's running through is a theme of an absence of clearly defined accountability within the system.
A couple of points I want to make, a couple of very brief points. The first one is, we have a serious problem in a democracy when a parliamentary question is put to the Minister for Health, and the question is, what has been the outcome for patients who are denied access to treatment, to neurosurgical treatment? And this question was referred to the HSE, and the response, can I say that? Am I allowed to, to give the response, Chairman?
Go ahead, yeah.
The response was, on-call letters typed from April 2010 are stored on the hospital's hard drive system. However, the Neurosurgical Research and Development Unit does not have the resources to retrospectively review these letters. Now, Chairman, these letters are about patients who were referred for treatment to Beaumont Hospital, were denied treatment, and I and others still cannot get an answer as to what the outcome for those patients was. I want to know, and a lot of people want to know, how many of those people died, what was the level of mortality, and what was the level of morbidity. And I'm specifically asking what those figures for 2011, 2012 and 2013. It is a legitimate question and it should be available.
Well, can I just ask, sorry, not ask, I just think that maybe we as a committee might take that up and see if we can get an answer to that, to be fair. I mean, it is a legitimate question. And I think that would be, we might after the meeting, take that up with the HSE.
I'd like to concur.
Chairman, I would suggest that we need to have a special session on neurosurgical services and neurotrauma services.
Well, as I said, Deputy or Senator Crown, this is the first of the meetings,
Yes.
and I certainly think, and I don't want to preempt the rest of the, because I know there's a couple of other members want to speak, but we will certainly come back to this. I think that is a given. Okay.
Be very brief because previous speakers and the contributors have covered most of those things, so it's just around 2 points.
Oh, yeah.
Like others, can I thank you? It's very interesting for someone like myself who's no knowledge of neurosurgery or the services for that matter until the past year and a half or so. And so coming at it from a disadvantage in terms of knowledge. But I think Professor Hardiman put it very well there in your final contribution. There is a thread that runs not only from the four of you as contributors, but I think from all of us on this side of the House, that we want a better service that comes out, I think, strongly in the thing. And that leads on to the other thing that where you have this very big vacuum, as again previous speakers have said. We can talk to the wall all day here, but if we can't get some sense made of the questions that's raised, that's not your fault. It's HSE and HIQA have a responsibility in this. So apart from better service, I think all of us want the accountability thing, because that's the cardinal of the whole thing, that if you don't have that, you don't have anything. There shouldn't be, taxpayers shouldn't be paying for a service where there's no system of accountability for how it's carried out or how it's performed. Doctors are not, with all due respect to you, above the law and above accountability, and that's the way that I think it should be in a caring society. And to conclude, Chair, Deputy O'Quillan put it perfectly right, and I agree with him entirely. I may not use the blunt language that Mr. Lawless has used in his very interesting contribution. I read all of it. It's very good. It's very informative. Well, I've used language probably which is worse than what you've used, Mr. Lawless, but I wouldn't put it in print. But I agree with Deputy O'Quillan. It should go to the HSE, and you have a perfect right to, and your recommendations, I can't find any flaw in them. Perhaps there are, but I'm not a medic. But he's perfectly right. That's where they should go, and we should know all of these things. Thank you, Chair.
Thank you. And just on that, just to again thank all of you, and to Mr. Lawless, thank you for being here, and I want to extend on behalf of all the committee our sympathies to you and your son and the death of your wife, Nuala, and I want to admire your passion, and I've read your report and I've met you yourself as well, and I certainly do believe that you need to get answers, not just you personally, but I think there needs to be answers given in the context of the debate, and I think as part of our debate there needs to be a further meeting of the committee, and if I could do that.